Welcome everybody again to another episode of the ideaXme show, the show that profiles the humans behind the really big ideas that shape the world, inspire the future and future creators, and for all those that like really great stories. I'm Ira Pastor. I'm your health, aging, and longevity ambassador along for this journey. So today we have a really fascinating show that's focused on the intersection of the cardiovascular system and the skeletal system, and some fascinating recent evidence that suggests a really unique link between cardiovascular disease, which we've spoken a bit about on the show, and osteoporosis, which we've not really talked that much about, but it in general represents a disease where there is loss in density and quality of our bones, where they become porous and fragile over time with increased risk of fracture. It has been long known that the supply of blood, the vascular supply, is very important for the healing of our bones after we break them. Obviously, bone marrow is very important in various physiological processes going in the other direction. However, not as much has been known about ultimately how blood vessels in bone contribute to bone health and disease, and also the reverse, sort of the unique dynamics that go on in the bone microenvironment can affect other tissues. Additionally, some of the data that's presented by our guest today suggests really unique connections where the processes of disease and aging can close off our vascular systems, where blocked vessels really become bone-like in their structure. And this is not a case of atherosclerosis, which we've talked about on previous shows, where there's a narrowing of blood vessels with plaques, where the blood vessel is sort of still the blood vessel. In these cases, the blood vessel looks and it feels like bone, has been closed off, and is sort of referred to as a microvascular dead space. So it's going to be a very interesting topic. Dr. Rhonda Prisby is joining us today. She is Associate Professor in the Department of Kinesiology and Applied Physiology at University of Texas in Arlington. And with a PhD in Kinesiology and Exercise Physiology, her research in the Bone Vascular and Microcirculation Laboratory has focused on this unique epicenter and interaction between blood vessels and bone in both states of both health and disease. So it's a really exciting topic. And Dr. Prisby, thank you for taking the time to come on the show today.
Oh, thank you for having me.
It's our pleasure. Typically, we give our guests the floor at the beginning of the show just to talk a little bit about themselves, introduce themselves, where you grew up, how you got interested in science, in bioscience, and ultimately sort of what led your path towards this really, as we said, this very unique intersection between these two important systems, cardiovascular and skeletal.
Okay, so first, a slight correction. I'm in the Department of Kinesiology.
Okay.
I think my chair would have a fit if I didn't correct that. So it's still at the University of Texas at Arlington. So I kind of have a unique path, I think, to where I ended up today, because originally starting out, especially in undergraduate school, I was not really interested that much in science. Okay. So I have a liberal arts education, and we have to take a variety of classes, and so I was exposed to science courses. But I actually have an art major. Yeah. And I did not actually get into research until I went back for my master's degree at Kent State. And even at that point, I was interested in going into cardiac rehabilitation. So I was going to get my master's degree with a non-thesis option. My last year there, just as I was getting ready to graduate, a new professor had come into the department, and she had kind of encouraged me to get involved with research. And I found that I really loved it. And so from there, I switched to a thesis option, and I spent another year at Kent State. I completed a thesis, and then I went on for a PhD. I got involved looking at the bone microcirculation when I went to work for Michael Delp, who at that time was at Texas A&M University. And he was interested in looking at the bone microcirculation. In his laboratory, we have an interesting technique. It's called the isolated microvessel technique. Okay. And it's where we can take small blood vessels out, we can keep them alive, and we can actually view them on we put them on the stage of a microscope hooked to a video camera. We can view the blood vessel on the monitor. And by adding different vasoconstrictor or vasodilator agents, or changing pressure or flow, we can watch the vessel constrict and dilate to these various activities. And so that's how we study vascular function. So I went to work with Michael Delp, and I got involved in looking at the bone blood vessels and looking at the functional properties of these blood vessels. And so from there, I did a second postdoc, and I actually went to France to complete this postdoc, and it was in bone biology. So in Dr. Delp's lab, I had the opportunity to look at, of course, the vascular system. And in France, I had an opportunity to learn more about bone biology, but they also was interested in looking at blood vessels in the bone. So I found the combination, I think it was a perfect fit for me for what I wanted to pursue. And so from that point on, when I established my lab in 2009, it was with the intent of combining the two disciplines, vascular and skeletal system, and kind of looking at them in tandem and seeing how the vascular system and the changes in blood vessel function with age or disease would influence the skeletal tissue.
Fascinating, fascinating. And you know, when you talk about, you know, the microcirculation, and you know, you also mentioned on your website and some of your papers, you know, this concept of the microarchitecture of bone. And when we think of bone, we don't, you know, compare it to say the brain or the kidney or something like that. We don't normally think of it as being, you know, I probably overuse this word. It's a very dynamic ecosystem that's going on. It's not, you know, we know, you know, there's calcification and mineralization and so forth, but you know, there's a lot more going on in terms of the bone being built up and dissolving, and the bone marrow, and obviously everything you're doing. Can you just talk a little bit about sort of this domain of the microarchitecture, as you refer to it, and sort of this intricate area that you're looking at, so we can, because we I guess don't normally think about what it means to have microcirculation in the bone.
Yes, so there is a misperception that the skeleton is this dry and inert material, almost as if it's dead tissue.
Right.
And the skeletal system is one of the most dynamic tissues in the body. So in addition to being highly fluidic due to the blood supply and the interstitial fluid within the space, it's highly dynamic. So if you think about the activities of the bone cell that builds up bone or degrades bone, you also have to think about the bone marrow, which is inside skeletal tissue, which is responsible for producing blood cells. And so we have all of these cells in different organ systems. If you consider the marrow, the bone tissue itself, and the vascular system as distinct organs, you have the confluence of three organ systems right there in one space. And so we have to stop thinking of the bone tissue as being not important or not influential over our overall health, because a lot of activities take place in the bone that can influence our general health. For example, if for some reason we stop producing our immune cells or stop developing our immune cells, that's going to affect our overall health. And so one thing that I try to do in the lab, leading off of my mentors, Dr. Michael Delp and Dr. Marie-Lynn Lafage-Prue, is that I try to get people to understand that it is two systems, or actually three systems, that work in tandem or in coordination with one another. And if one system has a dysfunction, that can lead to dysfunctions in other systems.
Now, you, a couple months ago, you had this fascinating paper in the Journal of Microcirculation. It was entitled Discovery of a Bone-like Blood Particle in the Peripheral Circulation of Humans and Rodents. You know, looking at it, it was it's almost scary in the context that we think of, you know, we've discussed atherosclerosis on the show before, and we've talked about, you know, plaques, and we've talked about sort of senescent macrophages and the different things that go on. But this was much different. It was almost science fiction like that. You know, when you talked about, and you know, and the way you wrote about it, sort of this stuff does not look like atherosclerosis at all. It is clearly an entirely different pathology. Could you describe some of, you know, what you found in this particular? I mean, you've written about this more than in the one paper, but can you just describe what's going on here to give us a better sort of understanding of what it means to have bone-like particles in our blood, and then obviously the microvascular becoming bone-like.
Yes. So the evolution of this discovery, it's actually a series of discoveries that kind of took place by accident. So as I mentioned earlier, one of the techniques that we use in the lab is isolated microvessel technique, where we're able to take out blood vessels and study the function. So I was attempting to take out the bone marrow blood vessels. So I work with rodent models that we have access to the bone marrow. And I had access to the bone marrow, and while I was looking inside the bone marrow, I was searching for patent and functional blood vessels. And I happened to stumble upon what looked like calcified tissue in the shape of a blood vessel. And so upon further investigation, I found that indeed that it was a blood vessel, but it had taken on the appearance of bone tissue. In other words, if you think about bone biology and the morphology of bone, it has characteristics, for example, what are called osteocyte lacunae on the surface of the bone and the interior of the bone. And these blood vessels had that on their surfaces. When we stain these blood vessels, they stained extensively for calcium, and they stained as bone tissue. We were able to do some cross-sectional analyses of these blood vessels and determine that in some cases, the blood vessels were completely filled with unknown cell types or filled completely with collagen, which means that the blood vessels no longer they weren't able to pass blood. They were non-patent. So when we were looking at these blood vessels under higher magnification, we noticed these particles that were attached to the outside of the blood vessel and sometimes on the inside of the blood vessel if they were somehow not completely what we call ossified. And so this is how we discovered these particles. So what we wanted to do in this study is that we wanted to, with scanning electron microscopy, which is a very high resolution microscopy, we wanted to compare these, what we call ossified vessels, to normal blood vessels. So we just took aorta from a rat and we prepared it for the scanning electron microscopy. And we happened just by chance to notice what appeared to be one of these little particles sticking out of the wall of the blood vessel. So for me, that meant that if these were the same particles, somehow what we were seeing inside the bone marrow and the particles that were attached to these ossifying vessels in the bone marrow, these particles could somehow detach and get into the circulation. So we collected blood samples from rodents and we collected blood samples from humans, and we were able to detect these particles and actually capture images of these particles. So the significance of these particles is the morphology of the particles as well as the size. And so the morphology or the shape of these particles, sometimes they have jagged and rough edges, which means that if they're traveling in circulation and they get close enough to the blood vessel wall, they can induce damage. And once you damage the blood vessel wall, that can lead to processes such as atherosclerosis. Another consideration is if they damage the blood vessel wall, do they have the capability of adhering to the blood vessel wall? And if they're bone-like particles, once they adhere to the wall, can they continue to form bone? So another aspect that makes these particles daunting is the size of the blood vessels, or I'm sorry, the size of the particles, and we call them ossified particles. So the vast majority are very small, so they're less than 10 microns. But there are a good number of these blood vessels that are 15 microns and above or higher, which means that the size of these blood vessels has the capability of blocking up some of the smaller blood vessels in the circulation. I mean, the size of the ossified particles are large enough to block the smallest blood vessels in the circulation. So then we have to ask ourselves, well, perhaps these particles are contributing to diseases such as atherosclerosis, or maybe generalized vascular dysfunction. Could they also contribute to diseases like heart attack and stroke?
It's scary. Scary thought. Just thinking through it. So you know, some of the work that you do in studying then sort of the processes that lead to their formation in the first place involves certain hormones, and you know, the parathyroid gland, which is normally responsible for certain components of I guess, calcification process and in creating new bone. What are you learning in terms of sort of the hormonal, the endocrine connection here? And obviously these are early days in the work, but are you seeing certain paths towards intervening at some point to prevent their formation? I just think, with all the time that sort of the pharma industry has put into sort of cholesterol and traditional atherosclerosis, here's another layer that, wow, this sounds even more daunting. But talk us a little bit through that and some of the things that you envision, and some of the other different experiments that you do in microvascular lab when you're looking at these materials.
Yeah, so we do a lot of work looking at parathyroid hormone, and if you know about parathyroid hormone, it is a treatment for osteoporosis. If you have hyperparathyroidism, you will have a degradation of bone. But if you have parathyroid hormone treatment, which is usually an injection per day, if you think about animal studies, it causes bone formation. So you kind of have this paradoxical activity of parathyroid hormone that leads to opposite ends of the spectrum. So we have been mostly looking at the influence of parathyroid hormone in young and old rats. And so we study the vascular function. We have a good idea if we treat the animals for a certain number of days intermittently with parathyroid hormone that we can induce bone formation. And so our angle is to look at how parathyroid hormone affects the blood vessels. Since our premise is that if you have a change in vascular function, either a decline or an increase in vascular function, you could influence the skeletal system. And so our aspect has always been, we know what parathyroid hormone does. Intermittently, we know that it builds bone. So what's happening to the vascular system? In regards to looking at what we call bone marrow blood vessel ossification, or what we like to think of as the conversion of these bone marrow blood vessels into bone, and then you have a separate pathology, which is the generation of these ossified particles. We have been mostly looking at this in terms of an age-related change. So one thing that we have noticed is that when we perform our experiments looking at vascular function, when we take the bone marrow out of the animal and put the bone marrow in the bath with the blood vessel, we notice that it causes vascular dysfunction. So to me, that was intriguing because we use a certain animal model, and I've been using this aging rat model for a number of years now, and never have I seen blood vessels that look like what they look like in the marrow. And to me, that suggested there's something in the marrow that's causing this. Because if you take out blood vessels in this particular rat model, if you take out blood vessels from the heart, from the kidney, from the skeletal muscle, from the brain, the blood vessels never look like what we see in the marrow. So when we put the marrow in the bath, we were able to induce vascular dysfunction. So to me, that suggests that the marrow is filled with many different types of cells. Perhaps they're releasing factors that cause ossification of these blood vessels. So recently we have, I had an American Heart Grant to look at this to see if somehow we can correct this. So within the marrow, we know that there are pro-inflammatory cytokines and anti-inflammatory cytokines that are produced. And when we analyzed what the bone marrow cells were giving off, there were many pro-inflammatory cytokines that were being given off. And so the premise of the American Heart Grant was to treat the animals for a certain number of days with an antagonist to a particular pro-inflammatory cytokine. So in other words, if we treated the animals with this substance, we would maybe somehow reduce the amount of inflammatory cytokine that was being produced by the bone marrow, and then perhaps we can reverse what we were seeing in terms of blood vessel ossification or the number of ossified particles. So the grant has recently expired, but we still have ongoing data analysis. In this grant, we're looking at young and old animals. We performed a surgical technique called bone marrow ablation, which means that we ablate the bone marrow. We remove the bone marrow contents from the long bone of the rat, the femur. with the idea that once we remove the bone marrow content and we allow the bone marrow to reconstitute itself, if we give this substance to block inflammation, can we regrow normal blood vessels? And if we regrow normal blood vessels, in theory, we should be able to reduce the number of ossified particles in circulation. So that's the premise of the grant. And so right now, these are the interventions that we have ongoing. Some of the other things that we'd like to look at, and I think is very critical to look at, is we'd like to get a further chemical analysis of the bone marrow blood vessels as well as the ossified particle. Determined. So right now we're very careful. We say it's bone-like.
Right.
We're not making the statement that it's completely bone tissue. It may be that it's a hybrid tissue in terms of if we have these blood vessels that are converting into bone, maybe they still have characteristics of blood vessels, and maybe they're acquiring the characteristics of bone tissue. So that's one thing that we need to investigate is what level of bone tissue have they converted into. And then we'd like to also look at the ossified particles more closely on a chemical analysis to determine their exact composition.
Fascinating. Fascinating. I love the, again, we talked about this concept on the show before of sort of inflammaging and this intricate connection between aging and sort of a variety of pro-inflammatory conditions. So I like seeing that connection. The other thing that was coming to my mind as you were talking about this sort of the bone marrow environment and of those stem cells. Do you think there's anything, because we've also touched on in previous episodes this topic of transdifferentiation of cell types, or dedifferentiation that may normally, we think about it in cancer and so forth, but do you think there's any of that going on in the sense that is it possible that via some factors, paracrine factors or whatever, their stem cells are getting the wrong signals and becoming something as opposed to, that hit the top. I was thinking about that as well.
Yes, so there's evidence in the literature that, and we don't even have to go as far as stem cells, we could look at the cells of the blood vessels. So there's evidence in the literature that says that both endothelial cells and vascular smooth muscle cells have the ability to convert into osteogenic phenotypes, which means that they will lose whatever their native characteristic is and they will start to produce mineral. And so one of the future studies that we hope to engage in is we have ordered and we have created through a company animals that we have put a fluorescent marker inside their vascular smooth muscle cells. And what we will do is we allow these animals to age, and we know as a function of advancing age, the blood vessels in the marrow become progressively ossified. So at a certain time points where we know we will be able to see this, we will activate this fluorescent signal in the vascular smooth muscle cells, and hopefully we'll be able to determine whether or not the vascular smooth muscle cells are converting into this osteogenic phenotype. So another thing to consider is that endothelial cells also have the capability of transitioning back or de-differentiating back into this osteogenic phenotype. So it could be that it's endothelial cells as well that's contributing to this problem.
One of the technical area I wanted to just ask you about while I have you, a couple of years ago, you have another paper. It was in Aging Research Reviews. It was on basically on the topic of body vibration or whole body vibration on skeleton and other organ systems, and it got me thinking about we talk a lot about the sort of the biochemical dynamics that go on in a lot of these disease states and aging and so forth, but there's this whole sort of this biophysical, the biomechanical domain that we don't think as much about. But when it comes to bone, there's a lot going on. You have these shear stresses and friction and forces of mechanotransduction, a lot of other neat stuff that's happening in the biophysical component alongside the genes and the proteins and so forth. Can you talk just a little bit about sort of how sort of the biophysical and the biomechanical dynamic of the bone sort of fits into your research and the way you look at the system?
Yeah, so this is actually when I went for my first postdoc with Michael Delp, This was the premise of his lab, that the
Mm-hmm.
vascular system would influence skeletal system. And one of his theories, and one thing that we pursued, was that when you talk about mechanical loading, and
Okay.
if you think of it from a classical bone biology perspective, it's the mechanical loads. If we're running, if we're walking, if we're jumping, we have mechanical stresses that we're placing upon the skeleton. And in response to these mechanical stresses, then the skeleton will either form bone, in the case of, for example, if you're an avid runner, or if you're a basketball player and you have a lot of mechanical stresses placed on the skeleton, you will build bone. In the
Mm-hmm.
case of someone who's sedentary, who's not putting a lot of mechanical stress on their skeleton, then you could have bone degradation. So, but the actual, I guess, mechanism associated with that mechanical strain on the skeleton that causes bone loss or bone gain is not the actual load itself. So when you walk or when you jump or when you run, you're placing these strains on the skeleton, but it's the fluid inside the skeleton that's shifting.
Okay.
And in response to these shifts in fluid, you will have shear stress that are either placed on osteoblasts, which build bone, or osteoclasts, which degrade bone.
Mm-hmm.
And in response to this shear stress, they will release the factors to build or resorb bone.
Okay.
So when you think about the mechanism that's behind mechanical loading, it's the fluid in the skeleton that allows for this change. And so that's one thing that we want to investigate. So if it's the fluid that allows for this adaptation, then the vascular system plays a much more important role than what people give it.
Mm-hmm.
And so that's the basis behind, if you think about mechanical stresses, and at least the impetus for our lab and the work that we do in our lab, and the work that some other people do in their labs.
Fascinating. Fascinating. I appreciate that. Coming back to you now, you talked a lot about Michael Depp and as an influencer in your research. Are there other influencers, people that you want to give a shout out to that have, influenced your path to stay this course over your career, that, if it wasn't for them, you'd be doing oncology research or something totally different? Anyone else you want to give a shout out to?
Yeah, I had mentioned the professor at Kent State, Ellen
Sure.
Glickman,
Okay.
who actually got me involved in research. My parents, of course, who not only for research, they were supportive in all of my endeavors. And so definitely they have to be acknowledged, Richard and Thelma Prisby. And so I can think of a lot of different people along the way, probably who have helped me along the way, and I can't remember all of their names. I would say that, when we're going through life, there's many people that we only pass us for a day, but somehow they influence us.
Yeah.
And so I think that probably there are so many people that if I start naming someone and leave someone out, it might cause friction. But there are many people in my life that have influenced me.
Wonderful. Wonderful. Well, Dr. Prisby, it's really been an eye-opening talk, and you sharing your knowledge with us on this really unique and in many ways unexplored domain of biomedical research. Really wishing you the best with all of it, and hopefully we see more and more of the important learnings that come out of this in terms of human health and aging. For everybody that is going to be watching or listening on the podcast, we've been spending time with Dr. Rhonda Prisby, Associate Professor in Department of Kinesiology, University of Texas Arlington, doing really amazing research in the bone vascular microcirculation laboratory at this unique intersection of the cardiovascular system, the skeletal system, many other systems as well. Rhonda, really thank you for your time today and sharing your knowledge with us, and as we say on the show, sort of moving the human story forward. It's been a great time.
Okay, I'd like to mention before I...
Please do, take the floor.
And so I've started a society called the Bone Vascular and Microcirculatory Society.
Okay.
And it is www.bonebloodvessels.org.
Okay.
It's a society to kind of highlight how the vascular system influences the skeletal system.
Excellent.
And I'm hoping that a lot of people will join as members. Membership is currently free. For scientists out here, we have a monthly journal club where we discuss articles related to bone blood vessels, the function of bone blood vessels. So I just wanted to mention that before I go. And I'd like to thank you, Ira, for having me on the show.
No,
It's always
it was a
nice
pleasure.
to come on and talk about research.
It was a pleasure, and we will on the permanent blog page that we're going to put up to you. We'll link to that as well as on the podcast page and the YouTube page. But pleasure seeing you, and it was a great time. Thanks so much for
Thank you.